In order for us to create a calm clinic, we need to recognize what patients look like when they're stressed and then take the steps in different areas to prevent the stress in the first place. This is not just for our patients, but also for their pet parents and our veterinary teams. Let's understand the 4 F responses to fear. The first is flight. Dogs and especially cats need opportunities to avoid stressful situations. And if a choice is not given, like a towel or a hiding space, these patients will attempt to escape. This prolongs exams and can be a response that escalates to the next and more troublesome fearful behavior. Yes, you guessed it. The second is fight. When no escape route is seen and fear continues to rise, our patients demonstrate last resort behavior, aggression, or more recently known as reactivity. There's a common misconception that this is the first sign of fear, but in fact, it's a much later stage. Do not wait until the fight to intervene with your patients. The third, and the one most commonly missed, especially with cats, is freezing. Early in my career, I would praise my feline patients for being perfect statues on the exam table, unaware that they were actually trying to disconnect from a very stressful experience, my exam room. When a cat starts to slow down movements or stops moving altogether, recognize this early sign of fear that needs to be acknowledged and addressed. The final response to fear is to fidget. This behavior is shown by an adolescent patient who's being mouthy or often gets mislabeled as naughty. This patient's actually scared, and the same plan applies here. We need to quickly recognize, pause, and find an alternative strategy for handling. The more we feel comfortable recognizing how our patients communicate fear through different body language, the earlier we can intervene and employ strategies to relax everyone in the exam room.